are you doing today?
I'm good.
My name is Maddie. I'm going to be your student nurse today. Can you please tell me your name and date of birth?
Katie Youngberg, 9/29/2000.
Okay, good. Have you used the restroom before this exam?
Yes.
Okay, and then are you feeling any pain or discomfort?
No.
Okay. So we're going to be doing 3 different assessments. I'm going to be assessing your heart, lungs, and abdominal area. Do you have any questions? Okay. So we're going to start with respiratory. I'm just going to ask if you can sit up and swing your legs over. And I'm just going to start by, is it okay if I pull this? Okay. I'm going to start by inspecting your chest. So everything looks symmetric. Breathing is normal. And I'm just going to check your AP lateral diameter. Looks good. Respiration's steady. So now I'm just going to be palpating the trachea. And it's midline, it's normal, no masses or anything like that. Now I'm going to be palpating the chest. No masses, no protrusions, looks good. And then I'm going to ask you to swing your legs that way so I can do the same thing to your back. Do you feel any tenderness or soreness or anything? Okay, good. Okay, so now I'm going to be assessing your chest expansion. So if you could just take a big deep breath in and out for me. Okay, good. Now, can you swing your legs back this way? I'll be doing the same thing to the front. Okay. Okay, and it's symmetrical, so that's good. Now I'm going to be assessing tactile fremitus. So anytime I put the side of my hand on your body, just say 99.
99, 99, 99, 99.
Okay, and I'll be doing the same thing to your back. So if you could swing one more time.
99, 99, 99, 99, 99.
Okay, so everything feels normal, no abnormal vibrations. So now I'm going to be percussing. So I'll just be doing the back, the sides, and then your front. And I'm just going to fold up your bra. Okay, and then if you could just lift up your arms for me, I'm going to be doing your lateral. Okay, and then if you could swing your legs around, I'll be doing the front. Okay, and then if you could swing back that way, I'm going to be percussing a diaphragmatic excursion. So if you could just inhale and hold it for me. Okay. And it's okay if I mark your back really quick.
Yeah.
Okay, you can breathe normally, sorry. And then now I want you to exhale and hold it. Okay. You can breathe normally. Now I'm going to be doing the same thing to the other side of your back. So inhale and hold it. Okay, you breathe normally. Now I'm going to be doing the exhale. So just exhale and hold it. Okay, so I'm just going to measure both. Okay, so they're both about 4 centimeters, and the left one is a little bit lower, so it's normal. So now we're going to be doing auscultation, and I'm just going to be listening for all your normal breath sounds. So if you could just take deep breaths. Medir lateral. Okay, everything sounds normal. No thrills or anything, no wheezing. If you could just swing your legs this way again, I'm going to be listening to the front side. Okay, everything sounds normal. So now we're going to be assessing your heart. So I'm just going to be inspecting your carotid arteries. Okay, so they look good. I'm going to be inspecting the precordium as well. So everything looks good. So now I'm going to palpate the carotid arteries. Expected. So I'll rate that a 2. Okay, so now I'm going to just be palpating your precordium. So I'm going to be doing the aortic, pulmonic, second pulmonic, tricuspid, mitral, and epigastric. Okay, so now I'm going to be percussing. No, I'm not going to be percussing. We don't percuss the heart. Now I'm going to auscultate the heart. Okay, now I'm just going to listen with the bell. Listen for any bruise. Okay, so everything sounds normal. No abnormalities. And then I'm just gonna auscultate the carotid arteries as well. So if you could just hold your breath for me. Okay, so everything sounds good. No abnormalities, no bruise, constant, steady, everything's normal. So now I'm going to be inspecting your peripheral, so if you could just lie down for me. So I'm just going to be inspecting the skin, so it's dry, warm. I'm going to be looking for any signs of edema, nothing like that. Maybe looking for varicose veins. Everything looks good. So now I'm just going to be taking all of your peripheral pulses. I'm going to be checking for them bilaterally to make sure they're symmetrical. Okay, so that's expected. Expected for the brachial. I'm going to do the femoral. Expected. Now I'm going to be doing the dorsalis pedis. And the posterior tibial. And then I'm just going to be doing the popliteal ones as well. Okay, so they're all expected, all symmetrical, everything feels good. So now I'm just going to be checking your capillary refill, make sure they're all good. Okay, so that looks good. Now I'm going to be doing the same thing to your toes. So this one is a little bit delayed. They do feel a little cold, but overall the finding is okay. So now I'm just going to be doing, I'm just going to be assessing your abdominal aorta, make sure everything like that is okay. Okay, that feels good. Okay, so now we're going to be doing the abdominal assessment. So I'm just going to be inspecting. So everything looks good. Lat size is good according to body. So if you could just take a deep breath and hold it, and then lift up your head and breathe normally. Okay, so no bulges or anything like that. So now I'm going to be auscultating the 4 quadrants. So the right upper quadrant, the left upper quadrant, left lower quadrant, and right lower quadrant. Okay, so I heard all normal active vowel sounds, so that's good. Now I'm going to be listening for your abdominal arteries with my bell. So renal, iliac, and femoral. Okay, so everything seems normal. There's no breeze or anything like that. So now we're gonna go on to percussion. So I'm just gonna be percussing in all 4 quadrants. Is it okay if I pull this down?
Yeah.
Okay. Okay, everything seems normal. Resonant sounds. So now I'm going to be percussing the liver span. So I'm going to start from an area of low resonance and go up to an area of dullness. Okay. Okay, so I'm just going to repeat that to make sure everything's normal. Okay, so I'm just going to be marking this. Okay, now I'm going to go repeat the same process. Okay, so now I'm just going to measure it to make sure everything's good. Okay, so it's about 4 centimeters, which is normal. So now I'm going to be palpating. So I'm just going to be palpating in all 4 quadrants, lightly to begin with. Let me know if there's any tenderness or soreness or anything like that. Okay, so it feels good, no masses or anything like that. So now I'm going to be going in with a deeper palpation, so just let me know if you feel anything, any discomfort. Okay, so no bulges, no abnormalities. So now I'm just going to be palpating your liver. So if you could just lift up and then breathe in and breathe out. Okay, so I felt the liver, so that's normal. So now I'm just going to palpate your abdominal aorta once again. Feels normal. And then last thing we're going to do, I'm going to ask you to sit up, and then I'm going to percuss, and you tell me if you feel any discomfort. Okay, so that's all we have for today. Everything was normal findings. Do you have any questions?
I do not.
Okay, so you can put the gown back on. And then if you have any questions later, you can just call us. The call bell will be right here. And I hope you have a good day.
You too.
Sorry, this bed takes forever to lower. Okay. I will see you later.